staging in systemic amyloidosis has kind of varied over time, and traditionally we've thought about cardiac biomarkers in the blood, so NT-proBNP and troponin, and then the addition of that of the free light chain, so the burden particularly of bone marrow disease is considered. And we also know, and has been discussed in this setting as well, that there are a number of other factors that are prognostic. So we know that your renal function, your frailty in general, your ability to do the 6-minute walk distance, your echocardiogram features, so that your GLS, and there's many factors that are significant. And I think we have used these traditional models, which are validated in a different treatment era, and they were validated, some time back. I think it's a good point for us to think that we need to validate these probably sequentially in different treatment eras and kind of over time. So we evaluated our patients from 2010 to 2019. Again, this was a majority of patients were treated with bortezomib-based regimens, and we looked at a number of factors that would predict overall survival. So NT-proBNP, we looked at troponin, and then we looked at DFLC, which is the difference in involved and uninvolved free light chain, as well as some more novel markers that are standardly now used, including global longitudinal strain and 6-minute walk distance. And we've actually found that when we've looked at these other factors in this multivariable model, the importance and significance of DFLC, which is traditionally thought to be a very important significant marker, kind of drops out and becomes not significant. We kind of try to understand, well, why is it that the free light chains that are trumped by some of these other factors? And we found that actually a large proportion of patients are achieving good, really excellent hematologic responses with modern therapies. And if you kind of analyze patients in subgroups of those who achieve complete hematologic responses, it's very clear that the DFLC at your baseline is not prognostic. Now, those who don't achieve a complete response, the DFLC does appear important and is prognostic. So, I mean, it's definitely of importance, but really reminds us that we need to consider, these different biomarkers in their different treatment settings, and this probably is likely to change over time. And again, I think I'm looking forward to seeing some of the changes in prognostication over the coming years and using a universally applied prognostication tool, which is important kind of clinically and also for clinical trials.